the science is changing on these things. However, like with the mask one, the initial one with the mask one, where he's like, well, don't wear the mask, and then do wear the mask, but he was only saying don't wear the mask because he wanted the other people to get him first. Like, just because you gave what you would consider a noble lie doesn't mean that you're not a liar.
Okay, so on Facebook, I posted this mashup on, basically all this news on Friday of Biden and the vaccine mandate and all of that. And then, of course, for me, I'm a movie dude. So for me, it was all about the Matrix trailer. So I made this little video of the Matrix trailer and him going, it's not about freedom. And then Jen Psaki talking about how we're not going to do migrants and let's move on. And just the hypocrisy of I made this little mashup video, post on my Facebook wall. But what I wanted to do is take a few quotes from it. I know both of you have probably seen it by now. This was a lady. I don't want to blast her and stuff like that because I went to high school with this lady. I haven't really talked to her, but I think it's indicative of the other side. That's why there's NPCs on your screen, folks, because they're the blue pilled using our definitions that we've talked about. And it was she immediately went up to I grew up in the 70s when the polio vaccines were required, so we had to talk about polio for a minute. And then I went through I talk about the history of that and saying, well, it's not really the same thing. And then she kind of said, oh, you don't know what you're talking about. Coronavirus has always been around. And then I basically went like, listen, my big issue is not about the vaccine as much as it's about big government telling you what to do. And then I try to post, like, not to her, to the group, explaining the whole show your papers things. And her response begins, this is where it really gets, to me, it got juicy, was millions of us are perfectly fine showing our papers. And I missed that when I first was dude. I don't know that any regime in history that's requiring papers that has not ended badly for somebody. So anyway, she goes a little further, and then the risks outweigh the alternative. And I basically tried the cordial, all right, listen, thanks for your response, blah, blah, blah. I think heart disease and cancer kills way more people. This has gotten out of control. And then she kind of says the naive thing, the NPC thing, right? About being a diabetic, managing her own health. She's vaccinated. And I hate the recklessness of someone taking my life away from that of my small children. So she's worried about her own health. I don't know if she meant her children too. And basically I said, we have to agree, disagree, freedom versus safety. And then she wrote, safety is freedom. And that's kind of where I left it. Then I wrote this long thing. I quote Snicker and his use of the term authoritarian psychopaths and all of that. So to come back to you guys, obviously, Bob, the politicization and miscommunication and misinformation of COVID is obviously widespread. That's not even up for debate at this point. It's like over policed now because you have to have a certain narrative. But what do you think about the mass? Are you shocked by the masses that are so willing to demonize and attack the people that don't fit? Right? They're not their narrative. So whether you call them unvaxxed or anti-vax or whatever they are, it doesn't matter. That's what they've been made into. This person just represents a voice that says, listen, freedom and safety are the same thing. She views safety as freedom. She wants to be safe. She doesn't want to be free. She wants to be controlled.
Yeah, that is a mindset. Am I surprised in September of 2021? No. If you said that 10, 20 years ago, yeah, I would have been surprised. I mean, that's the way people think now. And there is a divide. There is the good people and the bad people. Right now it's vaccines. It'll be something else after that.
Right. Yeah. Alex, whenever you and I were chatting privately, you used the term chains, and you just put a grin on my face because it was like the perfect way to look at how these folks look at things. They don't look at freedom the same way you or I would.
No, it's a completely different mindset. They are really looking at it from we are speaking different languages from what we think, and what they think is totally different. The only difference I will say is this, is that woman doesn't understand that if you get the vaccine, that you can still get the coronavirus and you can still transmit the coronavirus to other people. Those are all true. It's not like the polio vaccine, in that the polio vaccine stopped you from getting polio. Right now, if you get this shot, then your odds of getting in the hospital or dead go down. That's true. But when they say this part about the unvaccinated are the ones that are like the bad guys here, everybody's gonna give it. Everybody's going to transmit it. Everybody's going to get this disease at the end of the day. If there's one thing to say, it's that everybody's going to get this at one point or another. It's that, do you want to try to use the vaccine in order to lessen the symptoms? Do you want to try some other homeopathic ways to lessen the symptoms? What do you want to do to lessen the symptoms? And the part that really gets to me, and this is the part that I really like, when people tell me to trust the science, and then even if you've
I
gotten
apologize, folks. We're having
coronavirus,
some buffering issues.
that they still want us to get the vaccine even after you've gotten the coronavirus, when there is tons of scientific data that supports not only for this coronavirus but for the past. Once you get something, your body does build up an immunity to it, and you do get antibodies in your system for it. So you don't need the vaccine. The vaccine does not work as well as natural immunity works. So when they say, well, you got to get the vaccine anyway, even if you've gotten coronavirus, then I just kind of check out of that person having a serious discussion about it and realize that they don't know enough, and their ignorance is causing their blind fear, and they get mad when other people aren't as afraid as they are.
Bob, play devil's advocate, if you would, a little bit with what Snicker said there. Alex is breaking down the one of the concepts in particular is you've already had COVID, you should get the vaccine, those kinds of things. What are your thoughts on that? What are the evidence studies, any of those kinds of things pointing to? What could you really kind of throw into that mix to elaborate on some of that?
Well, I will go ahead and start. Just as when we were kids and there was chicken pox parties and stuff like that, if there's a vaccine available, that's the route you should go. But yes, if because you want to avoid the potential of being one of those few that get really sick or possibly die from any of these diseases. But I mean, there was just a study out of Israel that just came out a week ago or so, and they confirmed, and this is probably the most vaccinated country on the planet, they confirmed that natural immunity is 27 times more powerful than vaccine immunity. Now, this was before the Delta variant. I'll put that out there when the study was done, when the data was collected, but still. So, and that didn't come as a surprise to me. So I think now there is another study that is saying also that if you have had it and you do get one COVID shot post-infection, that's supposed to jack up your immunity that much more. Take that for what it's worth. I mean, I didn't analyze the study, but yeah, it is out there. Hey, bro, I think you're frozen.
Yeah, I don't think you can maintain that look forever.
It's going to try, but yeah, I mean, I think a lot of what you said is true. I think part of the fear for public is they don't want people to think that it's better to just go out and get infected when you do have the opportunity to get vaccinated.
Yeah,
I think
I'm having some weather where I'm at, so that's why we're having a problem. Sorry about that, folks.
Because there is a risk, a higher risk, particularly if you're an old timer like us.
Yeah.
But I mean, I think if you have been infected, that you should probably be set. And I think there was another study that, I think it was the Israel study showed that, out of all these people, like there was about 250 breakthrough infections for people that were fully vaccinated. And the people that were infected prior, it was like some ridiculously small number, like 18 or 19 people got reinfected. So that's where they got the 25 or 27 times more effective immunity. So, but you don't hear a lot about that from all the different TV doctors and all that. They're not really discussing it. I have noticed that some of the TV doctors are starting to mention it in passing, even Fauci, though he's not putting a lot of clarity to it. But at some point, I don't know how they can keep on ignoring it.
They're going to do it as long as they can.
Yeah.
They're going to ignore it as long as they can. And you know what? I don't know the why behind it. I think that's where I'm at. Like, I feel like, and I'm sure you feel the same way, or at times where you will listen to these episodes or you'll listen to these interviews and you know that they know better, but it just seems like that they're just not explaining it in a way that would make people feel at least give them more knowledge instead of just giving them more fear. Like, I feel like every time they do an interview, they're not educating the people on, exactly what's going on. They're kind of just like giving them enough of the information and skewing it in a way in which to build the fear instead of to build the knowledge. And I think that's where it really irks me, because like at the end of the day, you want to trust a guy like, somebody that's been in, the head of NIH. You don't want to trust a guy like Fauci. But since the beginning of this pandemic, he's been untruthful a lot of times. And I've heard him make the argument of like, well, the science changes and, there's things that change. And that's true. The science is changing on these things. However, like with the mask one, the initial one with the mask one, where he's like, well, don't wear the mask, and then do wear the mask, but he was only saying don't wear the mask because he wanted the other people to get him first. Like, just because you gave what you would consider a noble lie doesn't mean that you're not a liar. And then with the way that he parses his words when it comes to the gain of function research that was being done at the Wuhan lab, that he's trying to say that it's not gain of function. He gives a very like legalese kind of answer, so that way he doesn't get in trouble anymore. I don't know what point we have to get to. I mean, these guys, they're never going to stop doing what they're doing, I guess. But I just think it's very sad, and it's a sad state of affairs that we have the people that you would, that the woman that we were talking to before, to bring it back to this woman trusts Fauci, trusts the FDA, trusts the CDC, but if you take any kind of an objective look at what they're doing, you can't trust them.
Yeah, I think public health has taken it on the chin. There's no question about it.
Hey, we're News Talk with Brandon and Bob. We're here to tell you about some of the facts so you don't have to waste your time watching CNN.
We don't want you wasting any time with CNN.
Or Fox or MSNBC or some of these other guys that are making a whole lot of money.
Et cetera, et cetera.
It's not paying.